All right, yesterday we talked car maintenance. So you think about your car. If it's out of alignment, maybe it pulls to one side, it can shake. Imbalance creates strain.
Our bodies are similar. Being out of balance can cause a host of problems, and the pain can last a long time.
Laura Uran knows that well. She's here alongside Dr. Drew Drummond of the Spinal Balance Health Center. Good morning to both of you.
Nice to see you again. Welcome.
Laura, you had
nice
some,
to meet you.
Yes, you had some issues. What kind of problems were you experiencing and for how long?
A lot of problems with my spine and pain with my back, and my gait was uneven. The worst thing that kind of drew me to Dr. Drummond was that I was getting terrible spasms on the right side of my neck, and I was really walking like this.
My.
So it was kind of like a Charlie horse that never stopped, and it went on for months.
Oh, Laura.
So it was debilitating, and I just started not doing anything. I mean, I'm very active. I go out and I show my dogs, and I have a horse, and I'm out hiking. I really wasn't doing anything.
Wow. The pain, was it affecting work? You're a nurse.
I'm retired now,
Yeah.
but it would have had I been doing that. If I did anything, if I at all exercised or lifted anything, it would spasm even worse, and I just couldn't relax it.
And this went on for months?
Yes.
Do you know what you did? Was there any sort
I don't
of
think
trauma?
I did anything. It just, I don't think it was any specific incident. It just, I think it built up over time, and I have a lot of problems with my neck and with disc problems in my neck, and it probably just impinged the nervous.
Oh, over time, had you tried other treatments?
Yes, oh, many. I went to like MDs, and pretty much I tried medications, things, meds to relax muscles, anti-inflammatories, steroids even. Tried to do physical therapy, but could not do physical therapy because it would spasm so bad I couldn't.
Oh, wow.
They couldn't relax the muscles to do that.
Yeah. So it affected your daily life?
Massage would help a little bit, for a short period of time.
What happened after you first went to see Dr. Drummond? Did you notice anything right away, or did it take a few visits?
Right away.
Right away. What happened? What changed?
It was just incredible. It's like this gentle little adjustment, and I thought, it doesn't feel like he's doing anything, really. And immediately, I could actually feel muscles just starting to relax.
No kidding.
It was like, oh, you gotta be kidding. That night I went home and I really just had tears in my eyes because it was such a relief. That pain just dropped away. And that's one treatment.
One treatment.
Wow.
That's remarkable, Laura.
Oh, it was great.
Yeah, Doctor, your patients have been coming on our show for years now, and this isn't the first time I've heard this, where they've been suffering from pain for so long. They come to see you, and sometimes, in this case, almost instantly, she found relief. What was going on in her case?
She had a strain to her nervous system. It just, her nerves were not functioning right and coordinating her body correctly. And when that happens, it just bubbles up as symptoms, and hers happened to be, in the neck. But then there's a lot of things going on with her that she didn't talk about that resolved, but we kind of focused it in with the neck. But yeah, once we adjusted her and got the strain out of her body, she was able to start functioning more normally. It just went away.
Is it common that someone sees an improvement initially? Or?
Yeah, I'll have some patients that it's just an immediate reaction, and some people it takes a little longer, because different people come in with different degrees of dysfunction. But usually, I'd say at least 80 or 90% of the time, in the first week or two, people will notice changes so that we know they're on the right track, and then over time, we'll get almost all of it taken care of. And if we don't, there are other types of care that we can then incorporate into what we're doing that'll help.
Yeah, and this is a NUCA treatment that we're talking about here. Can you explain what it is, how it works?
Yeah, the nervous system controls everything in your body. Nerve impulses are generated in the brain. They're sent down through your spinal cord and then out to your body, just like this is showing. And then nerve impulses go back up through your spine to your brain. And it's this dynamic communication that coordinates everything. And then when this isn't working properly, it will cause strain in the body that will just kind of bubble up over time as symptoms. It can affect posture. If it's not working right, it can affect blood flow, it can affect blood pressure, it can affect digestion, it can affect all sorts of things. So typically what happens is when people experience these symptoms, they go after it symptomatically, and they try and just push those symptoms back under the surface without really addressing the problems with the nervous system. So what we're simply doing is going, and we're, what she did when she came in to see me, she said, all right, I've done this symptomatic care for years now. Let's take another approach, and let's look at the other side of the equation, and let's start looking at the problems. And what we do is we adjust a misalignment at the top of the neck that very commonly interferes with the way the nerves work. And once we fix that, then her body was able to start functioning normally and heal on its own instead of just hit a symptom.
The other treatments she was probably getting care for was her shoulder. They were probably looking at her shoulder, right?
Yeah.
Since she had the spasms.
Shoulder.
Yeah. And
But
then,
yeah, you're addressing that
The neck,
tiny little bone in the
and
neck.
so if you went through the process of events, the atlas being out of place interferes with the nerves controlling the back muscles. Then the back muscles pull unevenly on the framework, forced her into an adaptive posture that put stress into her neck. And you can't look at the neck and retrace all that. You just have to go for the problem that most commonly affects it and fix it and see what happens. And that it works so well. How many patients have we seen that it happens to?
Some people watching may relate to her story,
Yeah.
but they might have some other symptoms, and they might be curious. How do they know if they're a candidate for this type of care?
You can't really look at symptoms. There's so many common symptoms. Any biomechanical symptoms like joint pain are really common, digestive issues, headaches. But if they ultimately, you would have to have me look at you, because some of them, it's really subtle looking at some people's posture to know if they have a problem. But some of the more obvious things to notice, if a person just looks in the mirror and they close their eyes and turn their head one way or the other, and then back and then down and open their eyes again, and they see that their ears are uneven, or it'll have to be quite a bit before they'll notice it. It's not a surefire thing at home because you're not trained, or if you look at your shoulders and they're off enough that you can see it, you need to get in and get
And it
checked.
sounds like she was way off.
Yeah,
When
when you got 2 inches off, it's noticeable.
We have this offer that Dr. Drummond brings because he understands that you might be curious, and so we think this value is extraordinary. The first 15 people who call, you'll receive a consultation, exam, and x-rays for only $50. So let's give you the number so you can call. There's also a website, spinalbalancehc.com, if you'd like to learn more about Nuka Care, kind of wrap your brain around it if it's the first time you're hearing about it. Maybe jump online, but take advantage of the offer now. It's 452-3400. Thank you.
and again, this is how Laura found out about it, is watching our show,
is.
seeing Dr.
It
Drummond
is.
on here,
And
then
now
giving them a
look.
phone call.
It's worth it, people.
We're so glad you're feeling well.
Thank
Thank
you.
you,
Thanks for
and
coming.
good to
Great
see you,
Thank you
Dr.
for having us.
Drummond. Several of